What we found is actually that gender discrimination sets the stage for sexual harassment. It makes it so that there's a climate in which the sexual harassment can occur. And this is clearly an issue that we struggle with in healthcare in terms of gender disparities in leadership, pay, and even acceptance of publications and grants.
Talking about this in the media, talking about this on social media, talking about this in academic journals like we have here, we hope to draw awareness to the problem and help people better identify harassment when they see it.
That's Dr. Christina Mangurian and Dr. Jessica Gold. They join us to talk about their commentary on the culture of sexual harassment and gender discrimination in healthcare. Their work appears in the September 2019 issue of the American Journal of Psychiatry. I'm Michael Roy, Executive Editor of the American Journal of Psychiatry, and this is AJP Audio. This month, we are happy to be joined again by Ann Thomas, host of APA's Medical Mind podcast. She'll be speaking with Dr. Mangurian and Dr. Gold. Hi, Ann, and welcome back to the podcast.
Thanks, Michael. Dr. Christina Mangurian is a professor of clinical psychiatry in the School of Medicine at the University of California, San Francisco. She's also vice chair for diversity and health equity at the UCSF Department of Psychiatry and immediate past chair of the APA Council on Minority Mental Health and Health Disparities. She is an NIH-funded scientist whose primary research program focuses on integration of psychiatric and primary care for underserved populations with severe mental illness. Dr. Mangurian also studies issues that affect women in academic medicine. Her work has been published in the Harvard Business Review and in many peer-reviewed journals. Dr. Jessica Gold is an assistant professor in the Department of Psychiatry at Washington University in St. Louis, where she's also a staff psychiatrist at the Habif Health and Wellness Center. Her work centers on college mental health, medical education, and physician wellness. In addition, she writes regularly in popular press outlets such as Self and InStyle about mental health and psychiatry. Dr. Mangurian and Dr. Gold, hi, and welcome to the podcast.
Hi, and thanks for having us.
Thanks for having us.
Your commentary in the September issue of AJP begins by noting that sexual harassment is common across scientific fields, especially in medicine. This is based on a 2018 report from the National Academies of Sciences, Engineering, and Medicine that reported on the climate and culture of sexual harassment of women. You write that this harassment extends to gender discrimination, which can affect salary, career advancement, and power dynamics in the workplace. We probably all know about the Time's Up movement, an anti-harassment initiative that was started by well-known actresses and other members of the entertainment industry, which grew out of the hashtag #MeToo movement. What might be less known in general is the prominence of this problem in other professions. So first, could you talk about how pervasive this is in healthcare?
Anne, thank you so much for this question, because I think you're exactly right. Most people don't know very much about this and how prevalent the problem is in healthcare. What was great about the National Academy's report is that basically they examined did a really comprehensive review across STEM fields. The biggest finding is they found gender discrimination is high in all STEM fields, but the worst in medicine. And these findings are important because of the quality of which they did their review. They did a comprehensive review across all these STEM fields, and they used standardized instruments. The strength of their report was also in the fact that it was broad in its view of harassment, including their definition. They included 3 types of harassment. There was gender harassment, and what that means is it's really kind of hostility towards women and any crude verbal or non-verbal behaviors that might indicate that women have a second-class citizen status. The second type was unwanted sexual attention, and the third is sexual coercion. And then they described the frequency in which harassment occurs. And what's really disturbing is that in the healthcare field, this can happen not just with your colleagues and supervisors, but and staff, but also with patients and their families. And they found that 50% of women experience harassment before they even leave medical school. And it's not just a problem for the doctors. It's actually for all of the healthcare providers, 80% of which are women. We know that 33% of nurses have experienced on-the-job physical violence and bullying. I also think an important number for AJP readers to know is that healthcare is actually one of the top 3 industries for sexual harassment charges filed by the federal EEOC, which is the Equal Employment Opportunity Commission. And what we found is actually that gender discrimination sets the stage for sexual harassment. It makes it so that there's a climate in which the sexual harassment can occur. And this is clearly an issue that we struggle with in healthcare in terms of gender disparities in leadership, pay, and even acceptance of publications and grants. I wrote a review in the Harvard Business Review kind of quantifying these disparities. Another interesting, I think, data point is that a lot of this discrimination appears to be specific to mothers. I did a study in JAMA Internal Medicine about discrimination experienced to close to 6,000 physician mothers in the U.S. 2/3 of them experienced gender discrimination, and over a third reported maternal discrimination around them being pregnant or taking maternity leave. Joan Williams, one of my colleagues and law professors at UC Hastings, who is just a tremendously brilliant woman, has written about this concept called the maternal wall, or the glass ceiling that women hit after having children, with actually a lot of the disparities in salary and leadership role being driven by motherhood. I would be remiss if I didn't mention that all of these problems are worse for women of color, women of the LGBTQ communities, and other intersectional identities.
Thanks. So you both are founding members of Time's Up Healthcare, which was launched in March of 2019. What are the goals of this group in the short and long term?
Thank you so much for asking. So the overall mission of the group is to insist on fair, equitable, and dignified workplaces for all women in healthcare. We believe in doing that, we would provide and promote higher quality patient care. The main immediate goals that we think about are that we want to unite healthcare workers across fields against harassment and inequity. This is a pretty broad goal, but we really, really believe in the intersectionality of these issues, as we were mentioning, even just if you consider field diversity to be one level of diversity, but then there's also ethnic diversity, gender identity, diversity, sexual orientation diversity. So are all of these things that we really want to unite so that we can have all the voices in one room. That we've done pretty well with our founders group and in some of our working groups where we're not just made up as physicians or psychiatrists, as both of us are. We have pharmacists, we have nurses, we have PAs, and there are some people in hospital administration, and we're always looking to learn more and get more workers involved. So that's one of the main goals that we're doing immediately. The second one is really to raise awareness and knowledge. So as you mentioned, some of these statistics are known and some of them are unknown, and they're definitely way less known in the public sphere. So, you know, talking about this in the media, talking about this on social media, talking about this in academic journals like we have here, we hope to draw awareness to the problem and help people better identify harassment when they see it. And then another immediate goal would be to link women to the Time's Up Legal Defense Fund. So when Time's Up Now was founded in January of 2018, they also launched the Time's Up Legal Defense Fund, which is housed at the National Women's Law Center. And it's basically a fund that is upwards of, I want to say, $23 million now. And it was funded to help survivors of sexual harassment and retaliation in all industry, with a specific focus on low-income women and women of color, and it basically functions to connect them with legal resources and public relations resources and helps defray some of the costs. One of the things I think is super interesting about this is we learned from them that healthcare, even before we launched, was the second largest group that was contacting the Legal Defense Fund. And if you think about this, as there are also plenty of low-wage workers that work in healthcare, and it makes a lot of sense that there would be so many people contacting them. And then in the longer term, a lot of that has to do with research and standards, so trying to promote higher standards to improve safety and equity in the workplace, supporting organizations to make the issue central and visible. So we see that as partners and signatories. Partners for us are these larger organizations like the American Nursing Association, the American College of Physicians, the Service Employees International Union, the National Medical Association, getting these groups on board to commit to talking about these issues and making them central. And then signatories are institutions for us, so that could be hospitals, that could be schools, nursing schools, pharmacy schools, medical schools, DO schools, and we're trying to get them to be talking about this issue more and to be working on measurement and standards. One of the things that's particularly important to the psychiatrists, I would say, in the group is to work on improving the care for targets of harassment and inequity. I think a lot of people don't necessarily even know where to turn when they have something like this happen, so trying to better understand that process across the country and how to make it better for people is something we're really interested in. And then, of course, trying to have a more inclusive and diverse workforce in general is a big, big goal.
Can you say a little more about how mental health professionals are uniquely qualified to promote change at the system level?
Of course, yeah, and I'm an administrator, so I'm one of the vice chairs in my department, but I'm also a scientist. And my science focuses on organizational changes to promote health. So I think a lot about system-level efforts to promote these changes. And I really do believe that as mental health providers, we're uniquely trained to understand the emotional toll that stressors like harassment, discrimination, and abuse have on individuals, whether it's by another individual or at the institution level or at the community level. So our combination of our mental health, in addition, the combination of our mental health clinical skills as well as being scientists position us well to develop system-level solutions to address these complex issues. And I think this can be done in 3 ways. So first, we can really take a leadership role in helping to design person-centered and trauma-informed approaches to for individuals and systems affected by discrimination and harassment. We can also educate organization leadership to recognize and respond to the psychological burden of these experiences without re-traumatizing the victims. We can also highlight the importance of supporting those that are helping those victims, the response teams in Title IX or care offices, because those are the ones who are at risk for both first and secondary trauma themselves. Second, I think we can understand how structural factors influence well-being. We understand that structural factors in the workplace can perpetuate discrimination. For example, a lot of my work has been examining family leave policies, and we understand that lack of family leave policies can adversely impact the well-being of individual workers, right, and causing stress and strain on the family if there's not paid leave. And so given that understanding about how structural factors and policies can influence well-being, our hope is to really use our knowledge, and I think we can as mental health providers, to work with Title IX offices to start developing pragmatic policy solutions to address underreporting and some of the fear that happens when people report that could promote well-being as well. Finally, obviously, our expertise in science and mental health positions us ideally to study the impact of workforce gender inequity upon mental well-being and burnout.
Thank you. Along those lines, in your commentary, you have a table that lays out a number of concrete steps that mental health care providers can take to raise awareness. And what do you think are some of the most important action items on that list?
Absolutely. So I think if you're at home and you're a single person and you're a mental health provider and wondering how you can help on such an issue, that can kind of feel overwhelming. The easiest thing to do is learn more about it. So one of the ways you can do that is to follow Time's Up Healthcare on all forms of social media, so Instagram, Facebook, and Twitter. It's just at Time's Up HC. That's one way to do it. There's a lot of data that we push out through there. There are a lot of relevant articles that we'll push out through there that'll help you understand the scope of the problem. Another thing you could do to learn more would be to join our listserv, which you can do by going to the website, which is timesuphealthcare.org, and then it'll say join us, and you can sign up there. Once you learn, I think then the best thing to do is to share it with others. So that could mean making interdisciplinary groups at your place of employment and talking about these issues, making sure that it includes trainees, but also making sure that you're looking at other fields. So if you're a psychiatrist, making sure that you're also looking at the other allied mental health professions or other non-mental health related medical fields, and trying to include everybody in the conversation so you can get perspectives intersectionally. Having places where you can present about gender harassment and discrimination, so that could be in grand rounds, it could be in workshops, it could be in journal clubs, wherever you can do it. I think just sharing the knowledge that you have is a really important thing. I think another thing you can do is learn about your institution and its policies specifically. So really trying to understand your organization's reporting mechanisms, the availability of trauma-informed care, what their sexual harassment policies are. If you understand all of that, then you also become a resource for other people or people who need help. So that's a really good way to lend your support to the issue, but really lend your support to people who need it. You can get your organization to join as a signatory. They're basically committing to 3 principles, and one of which is to measure sexual harassment and gender inequity in their systems, and we need a lot of data, so measurement is really important. I think so by getting your organization to join and commit to measuring and identifying metrics to ensure that the policies that they're implementing and the procedures that they're implementing are effective, and that we're actually measuring critical outcomes like the attrition of women and minorities, what the resource allocation equity is, what the health outcomes of the targets are, and that can be occupational, mental, general, medical health. I think having the ability to think about things at your organizational level, both from the research perspective, but also from the can you make a community that is having these conversations perspective, is a really easy way to get involved.
So you've talked about some of the systemic features that have shaped this culture of inequity. Do you think any progress has been made in addressing these challenges?
Oh, and definitely. I think that a lot of progress has been made. I also agree or believe that gender discrimination and sexual harassment is much more visible and understood, not just in healthcare, but across the U.S. It's been so wonderful to see the groundswell of women and men working to promote equity in terms of representation of leadership and salaries across disciplines in academic medicine. You can see it in terms of publications coming out across discipline. And I've also been really proud of work that's been done at my institution at UCSF, and I know there's other examples, but for example, at UCSF, there are regular salary equity reviews done by the Dean's Office in the School of Medicine, where all departments are held accountable if there are disparities in salary. And as of July 1st of this year, we have 12 weeks of fully paid family leave for all faculty members, for men and women, same-sex couples, people who've adopted, et cetera. And so I think that so much has been made, and so much progress has been made. That said, I think there's much more work to do.
So I learned about a lot of these issues actually by being on social media and seeing what a lot of the women who were working on this in research and had been dedicating their lives to this conversation for much longer than I had even considered practicing medicine. And from learning from them, I can hear what has changed, but I also think you can hear what still needs to be changed. I think women are more comfortable talking about these issues with each other and also talking about these issues like outside of secrecy, which is really important. Without the stories, which would be like almost the Me Too stories that inform Time's Up, you can't really know what is going on and what's been existing, and I think they're very powerful. And I think that if you look at least incremental changes, even just like with the family leave policy, which Christina was mentioning, I think you can tell that schools are thinking about this and trying to make changes. It's just they're not it's a cultural change. It's not going to be the quickest change you'll ever see. So there's definitely a lot more to be done.
And my final question is about what you think the future holds. Do you think we'll always need an organization like Time's Up Healthcare?
I'm going to be more optimistic on this one. So my perspective would be I'd hope that there are going to be a lot of changes quicker because we're speaking about this from such a public sphere. So I would hope that, first of all, in the future, we're not going to have to keep doing studies to prove that there is harassment and inequity in healthcare and that people will just accept that it exists. I think that hopefully organizations will begin to understand the importance of these issues to workforce health, burnout, and really also patient care. And I hope that physicians and leadership will start to look like the patient populations that we're serving. It's very hard for me to know whether we will always need something like Time's Up Healthcare. I see that our role is really to draw attention to the issue specifically now. And I think if the attention exists, maybe our role would evolve over time. It's hard to know whether we would disappear.
Yeah, and my take is that, I really believe that issues like discrimination, whether it's sexism, racism, homophobia, xenophobia, are really extremely challenging and complex issues that our country has been struggling with, and as well as many other countries for thousands of years. I'm very confident that gender inequities are and will continue to be addressed in healthcare. But I don't know if this issue will be fully resolved during my career. I think we're in extremely powerful positions as advocates for gender equity in the healthcare workforce, really because of the foundation that was laid for us by legions of feminists before us who were inside and outside of healthcare. I'm really proud that Dr. Gold and I and others on our team and others not within this team have been doing our part to help systems take some incremental steps in the right direction. And I know that it will continue going in the right direction. I just think the full resolving of these complex issues will take a very long time.
Dr. Christina Mangurian and Dr. Jessica Gold, co-authors of a commentary in the September issue of AJP on how mental health professionals can work to remedy inequities in the workplace. Thank you for speaking with us.
Thank you.
Yes, thank you.
And that concludes this episode of AJP Audio. You can rate and review the podcast on iTunes, Stitcher, or wherever you listen to it. Please also visit our website, ajp.psychiatryonline.org, to check out trending articles, find CME courses, and watch videos highlighting some of our other articles. APA and APA Publishing have other podcasts you can listen to. Psychiatry Unbound is the books podcast from APA Publishing. It's hosted by Dr. Laura Roberts, editor-in-chief of APA Books. You can hear the voices behind the most prominent scholarship in the field of psychiatry today. Also check out From Pages to Practice, which reviews the latest research published in the journal Psychiatric Services. It's hosted by Dr. Lisa Dixon, editor-in-chief of the journal, along with Dr. Josh Beresin. And APA's Medical Mind podcast, hosted by Ann Thomas, interviews APA members and other healthcare professionals about innovation in mental health care. You can find these podcasts on Apple Podcasts and on the podcast page of the American Psychiatric Association's website. Next month in the podcast, we'll talk with Abraham Reichenberg of the Icahn School of Medicine at Mount Sinai and from King's College London about his article on cognitive decline after onset of serious mental illness. We hope you'll join us too. Thank you for listening.